During the final stages of birth, when the baby's head has descended and can be seen at the entrance to the vagina, the skin and muscle between the vagina and rectum, the perineum, stretches to allow the baby to pass through. Sometimes the perineum doesn't stretch enough and it tears.
In the medical world, we grade tears of the birth canal into first degree, second degree and third degree. First degree tears are tears that involve just the skin of the vagina or skin of the perineum, which is the outside skin. And there is very good evidence from studies done by both doctors and by midwives that first degree tears do not require suturing, they don't require sewing up, and that they will heal very well on their own.
I had a tiny tear, but they said there's no point, it'll just heal, you know, once you start going to the toilet, it will heal on its own. So I was lucky with that, really lucky.
I tore 3 times, well, each vaginal birth I tore, they were all second degree tears.
Second degree tears, which involve not just the skin but also the muscle, and third degree tears, which involve not just the skin and the muscle but also the back passage. The same studies have shown that they should be sutured.
I had a second degree tear which healed very nicely without stitches.
I was stitched with the first 2, and they said with her that I didn't need to be, that it should heal by itself, which was nice actually not to have stitches.
Third one, he was big. He was 2 ounces short of 10 pounds. He came out looking like a sumo wrestler. So yeah, that was the last time I had stitches.
I know some people I know have had awful sort of infections and all the stitching's done badly or tightly and they have to have it done again, and it's a sort of nightmare. And some people I know years after are still uncomfortable.
I wish more people would speak up about their horror stories, about how damaged they've been from the episiotomies and how their sex lives have been ruined, and women just don't speak up, they just don't talk about it. Women don't talk about abortions, miscarriages or ripped perineums, you know, why not?
In the UK, 12% of all vaginal births will involve an episiotomy. When she was having her first child, Victoria had an episiotomy. A cut is made with a special pair of scissors to make more room for the baby to be born.
I had a third degree episiotomy which didn't heal terribly well because they stitched it too tightly. And I got an abscess on the stitches, so the midwife, when she came to visit me at home, had to take the stitches out and redo them because they'd just gotten infected and the stitching was too tight. And I spent 6 weeks sitting on the edge of chairs. I could not sit flat in a chair. Coming home from hospital, I was virtually kneeling.
For Caroline, her first birth experience with son Oliver left her deeply traumatised.
It should have been textbook birth. And it's hard for me to remember because I was drugged, so drugged. They took me off to the delivery suite, put me on my back on the bed, and then all of a sudden the room filled up with surgeons and gowned people, and the midwives would just look terrified. And then they told me that Oliver was stuck. And then I remember this Egyptian doctor, female doctor, saying, "We've got to give you an episiotomy," and they stuck my legs up in stirrups. She got the Von Twos and forceps out and then started pulling me and the bed across the room. And after an hour of this, I felt saying to this woman, "Get out from between my legs, you are useless, just move." So she moved out the way, and this guy just said, "Come on, we've got to get him out on the next push." And I remember screaming I was in agony. I thought my back was splitting because I now know he was back to back. And it was like pooing a bowling ball.
When an episiotomy has been performed, and it would be done either with local anaesthetic placed in the skin where the cut was going to happen, or very often if the woman has already had an epidural during her labour, then the epidural will take away all the feeling of making that cut. Of course, that cut is then sewn back up, and because there's such a good blood supply to that area of the body, it heals extremely well in the vast majority of cases.
The tear was severe enough for me to be offered a transfer to hospital, and I declined, and my midwife sutured it for me.
In the old days, silk was used, and that was not absorbable. And so a woman would have to have the stitches taken out by her midwife, perhaps after 7 days or 10 days. Now that we have dissolvable sutures, we really look for sutures that dissolve over about 10 days, 2 weeks. This provides an optimum time for them to hold their strength and allow healing to occur, but doesn't allow them to hang around so long that they cause a reaction or cause allergy or provide a kind of focus for infection.
I've since had the wound site examined by a consultant, and her comment was, "Oh, whoever did this did a great job." So I thought, wow, if you're going to have a tear, well, at least you're going to have a nice perineum after the fact. That's all good.
With a nasty infection that had developed in her perineum, Caroline was having no such luck.
Eventually, after 10, 12 days, I was let out and I went home, but I couldn't walk, I couldn't sit.
And had it healed by that time?
No, stitches still very present. This last stitch was removed at 6 weeks at the GP surgery. And then for 7 years, I couldn't sit on the edge of a bath.
To try and avoid tears or an episiotomy, some women have found that perineal massage does the trick.
One of the best things I did was massaging oil into the perineum from about 5 months pregnancy. I mixed up a sweet almond oil with a couple of drops of lavender in there and massaged it and stretched it very slightly as well, and I didn't have any stitches or anything at all.
I tore slightly last time, but that's because I was just so impatient. I didn't listen to the midwife and I pushed when she told me not to. But it wasn't major. It wasn't a major tear. So maybe it works, maybe it doesn't. But anything you can do to give yourself a better chance has got to be worth it, really.
I must start doing it soon, so I preach this to everyone and haven't done it myself yet. But that was. I'm sure, and I've recommended it to a lot of people, and it's worked for them as well. They haven't had any stitches, just it just makes it stretch nicely.
A couple of weeks later, Caroline gave birth to baby Barney safely. All her preparations paid off, and her midwife, Anya Metzner, has come for a postnatal checkup.
How are you?
My perineum just gets sore.
If you're not sure about it, or if you feel something's happening that wasn't happening before, then just, tell me.
It's just rubbing a bit.
Right,
but it's always when, if I've been running around too much and I haven't sort of rested enough. It's just the same old thing, really. But it can tell it's healing.